Liver cirrhosis, this is a dreaded word. People come to our liver clinic, saying that they've been diagnosed with liver cirrhosis, and they're very scared about this diagnosis. So what is liver cirrhosis? Liver cirrhosis, to put it very simply, is advanced scarring of your liver. Liver is a big organ, but it's a soft organ. When it gets damaged by many things, and I'll let you know what those things are, over a period of several years, the liver starts getting hard, irregular, and scarred. And this is liver cirrhosis. And once you develop liver cirrhosis, you will still survive quite long, 10-15 years, but gradually your liver functions will deteriorate. You will have risk of liver failure, and patients of liver cirrhosis are at high risk for developing liver cancer. So let's dial back. What causes liver cirrhosis and how you can prevent it? So many things which cause chronic inflammation of the liver. For example, alcohol use. If you drink a lot of alcohol, this alcohol slowly damages your liver over 5 years, 8 years, 10 years, and cause continuous liver inflammation, fibrosis, and cirrhosis. Similarly, other very common things such as fatty liver disease, which happens in people who are diabetic, people who are overweight, people who have insulin resistance. Even this, in some people, and about 10% of people who got fatty liver disease can progress to advanced fibrosis and lead to liver cirrhosis. Similarly, hepatitis B and C viruses, which affect about 1% of the average population, can cause liver cirrhosis. We have autoimmune liver disease. We have people who got excess iron and copper in their body. And there are a small number of people who got unknown causes, which can have chronic ongoing liver inflammation progressing to liver cirrhosis. The question here is that how do you detect liver cirrhosis early? So first of all, you must understand your risk factors, because not everybody is at risk of developing liver cirrhosis. For example, are you drinking excessive alcohol? You are at risk. Are you diabetic and obese? You are at risk. Have you checked for hepatitis B and C? Do you have a family history of significant liver disease? Has your doctor told you that your liver function tests are abnormal in routine testing? Were any abnormalities detected on an ultrasound scan? So it is also a good idea to check for the liver once you're above 40 years of age. So do a liver function test, do an ultrasound scan. So first of all, estimate your risk. Are you at risk of having a liver problem? Once you have that, then you must figure out, are you at risk of progressive liver disease? And how do you assess that? Now comes the difficulty. It's not easy to do a blood test or an ultrasound scan to say whether you've got a simple liver problem or liver cirrhosis. So we have a scan called liver elastography or FibroScan, in which you can assess the stiffness of the liver. When I started my talk, I told you liver is a soft organ. So if you can figure out whether the liver is soft or it is getting firm, you can really assess whether you have got a normal liver, a firm liver, or a hard cirrhosis liver. So do a liver elastography, which is also known as FibroScan. I'm not saying everyone needs to do that, but if you are at risk of liver disease, you must ask a doctor about the utility of FibroScan in your individual case. Get it done and you will immediately get an idea. It just takes 1 minute to get an answer whether your liver is soft or it is getting firm. So I hope you've understood the importance of FibroScan and liver elastography in detection of early liver cirrhosis.